So the existing technology has had many years to refine all the imaging views that it presents and the way that it presents them. So when you make your new machine and try to commercialize it, what effort will you do to try to be sure that your imaging technology and all the niceness of presentation also looks competitive with what's been produced before, as well as being a low dose potential machine?
Well, the answer, this is what we are trying to improve, okay? So this article, just because I have it here in my hand, it looks like, so this article the goal was trying to compare the round photo tube with the square photo tube, okay? So the person, I talked to this person, is from CDI Siemens, who wrote this article. The title is A Comparison of Pen Detector Module Employing Rectangular and Round Photomultiplier Tube, IEEE Transaction Nuclear Science Volume 42, number 4, August 1995. By doing that, they provide me a lot of information on both measurement, and also it shows the limit, and it shows that the limit are due to the geometry, this 2 by 2. Okay, so is it acceptable for you to see that if I put, instead of this 2 by 2, if I put the 3 by 3, this?
So you don't see that there would be any significant sensitivity improvement if you were to using your technology on a small field of view. There's no significant improvement relative to an existing system.
There is.
That's what I'm asking. That's what I'm asking.
Yes, no.
Is there a difference?
Yes.
If you were to a 16 cent, that would be your first target.
If you look at this picture at page 21, the difference is the vertical arrow.
Okay.
And instead, the other one is the horizontal arrow. The inclined arrow is the combination of the two. Better efficiency in electronic and better reality. Right now, the best PET scanner, HRRT, 2 by 2 millimeter crystal, 10 millimeter long, I think. LSO, very expensive. It's in the book, this is the first picture of the book. Well, that is implemented as a 2 by 2 camera. And they are summing A plus B plus C plus D and provide the analog sum to the digital A to D converter. You know that when you add something in analog, then you cannot separate it anymore. And that becomes, so you lose the information there. So the answer is, yes, there is possibility for improvement, but just by improving the electronic and get rid of that 2 by 2 and go with the no boundary and limit.
But in the question that my friend had here, if you made a 16 centimeter ring and made it smaller diameter just for the head, it would be improved because the solid angle is now much larger.
Yeah.
In that case, it would be dramatic. The
Yes.
16 longitudinal.
You're seeing about an order of magnitude difference.
Yes.
But one question about the head, the brain. We learned that one of the problems with current PET scans is that to do the brain is so rich in glucose.
Yes.
And FDG is after all glucose. So patients should be starving, they should eat. They don't follow those instructions all the time. So we tell them all that, the 200 instructions, and then when we ask them, I had dinner, I had breakfast, this and that. So they don't follow all those instructions, they just come in anyway. So when you do a PET scan in that setting, it's fairly inaccurate because there's a lot of glucose floating around, and the brain is full of glucose and it's going to always get black.
Show everywhere.
Yeah, so that's why most of the literature, at least in the medical side of things, is of the opinion that PET scan is not fully reliable for brain studies, at least as of now, unless somebody can figure out a way to do something other than glucose, maybe, I don't know.
I let that thing argue. For me, I try to provide a better machine. And I agree with Jerry, and that is my intention. The closer you get to the patient, and you say that the solid angle increases. Yeah, it's true. However, why instead the opposite? I have an email of the manufacturer saying, hey, now the wish list, what we need to do is to make a detector with a larger diameter. Do you know why?
So the whole body could go through it.
No. Because they said, in that way, the object in the center is very small and there is less parallax error. So that problem, so solving again the problem with mechanics. As it was solved before with the ring, the SEPTA ring in lead, solved with mechanics. It said, we have too many photons, confusion, let's just put the ring. And no, there is another way to solve. As you said, make the ring as small as possible, but then you need a sophisticated electronic, because the closer it is to the body, the more with an angle you get, and unless you have a very good electronic that can execute complex algorithm, then you run into trouble. And those are the trouble they wanted to avoid by increasing the diameter.
The thing, the total body PET scan, I think it's a concept. You'll have somebody walk through and do the whole body. I don't think it's a concept that would fly well with people who pay the bills, from what we meet with the insurance people all the time, and they hate this idea of people being screened at large. Everybody is and they have to pay the bills. So it goes against their concept to do that. So they're in the business of cutting costs.
This is the
so they always tell the insurance industry, the government, the state, whoever pays the bills. Unless you have cash patients, that's four different things. Well, so that's why they always say specific indication. That scan of the chest is approved only for the chest for these things. For the abdomen, so they kind of given you pigeonhole windows, and only if you fit those rules, you do those, they pay the bills. So they would be totally opposed, I think, to the idea of everybody being screened.
Yes.
So the PET scan will inflate the cost, and that is something they always are against.
Now, there is one thing that, fortunately, not all the insurance company are like that. There are some company, and I can make the name, it's Texas Instruments and Hewlett Packard, who require, in some cases, to have a checkup to their employee because they know the assets, the value that they have, and it's better to prevent something rather than the same reason why people are getting the flu shot and things, just to prevent from being absent.
That could be for a big executive.
Yes, but if you
take, how many big executives?
If you take McDonald's, if you take
actually, there is a tendency in the market today, particularly in big companies, to allow a certain across the board, actually, a certain level of screening. Not necessarily today on this type of level, but some kind of a preventive annual screen or whatever. If this technology becomes more cost effective and more in line with this type of approaches, it can easily become part of that type of approach. So it's just a matter of how you position it today. Obviously, I agree with you today. You go and try to do a scan on that costs $4,000. People will not allow that.
But I know the executives of a company. Like
sure, exactly.
Will pay the bill, so
sure.
that will be a small percentage of the population. But out there, the big majority of them who are paid by
in our company, for example,
United Healthcare or your government, etc. That's your big chunk of patients who have these scans, and they are going to be in the business of controlling the costs because they want to always put some brakes on it so you don't run too fast with it.
I'd like to go back to your point of high background and brain scans.
Exactly.
With more data, the more data you have, the easier it is to screen out that background and to bring out those the tumors, for instance.